Hello, my name is Roberta Cook and I am a nursing student at the University of Texas in El Paso. The incidence of asthma has been increasing. As a nurse educator, I was asked by a local high school to give a presentation on asthma, including in this video is pathophysiology, prevention, treatment, monitoring of effectiveness of treatment, and lifestyle changes. I hope you enjoy the video.
When an irritant enters your airways, the passages narrow and swell and produce extra mucus. This can make breathing difficult and triggering coughing, wheezing, and shortness of breath. When a person is having an asthma attack, they may complain of chest tightness or maybe even some pain in the chest. You'll hear them cough more. You may even hear a wheezing sound on expiration. All this causes difficulty breathing. Everyone's asthma is different. You may experience other symptoms and/or your symptoms may vary in intensity compared to others. When a person without asthma breathes in air, it enters through the nose or the mouth, goes down the trachea or the windpipe, enters the bronchioles or the airways of the lung. Blood is oxygenated in the alveoli and goes back out again. However, for asthmatics, this process is different and more difficult. In asthmatics, patients, the airways are very sensitive and may react to a number of different triggers such as smoke, pollens, or infections. This leads to constriction and inflammation of the airways, causing airflow obstruction. The inflammation and obstruction make it difficult to breathe and cause other symptoms you may experience. Let's take a deeper look into the bronchioles. As you can see, the bronchiole on the left is a normal bronchiole and has a large airway. When the triggers or the allergens or even viruses and air pollutions are breathed in, it causes the inflammation that you see on the right, makes it thicker, makes it tighter, and produces more mucus. The bands around the bronchioles will tighten. According to CDC, 1 in 4 people have asthma. 12.8 million people experience asthma attacks a year. 2 million people visit the emergency room. 456,000 hospitalizations each year and 3,630 asthma-related deaths per year. Approximately 10 people from asthma die each day in the United States. The prevalence of asthma is higher in females than it is in males, although in children, males are more often to have it. 0 to 17 in age is the highest prevalence. Below poverty level are at a higher risk, and northeast part of the United States has the highest prevalence of asthma due to the dust, the trees, and the dampness. Steps for prevention. Know your asthma triggers. Try to avoid them at all costs. You take your medications as prescribed. Track your asthma and recognize early signs of an attack. And know what to do when asthma gets worse. Some triggers for asthma attacks are dust mites. Dust mites are everywhere. We all have them. The best thing you can do is vacuum constantly and try to keep as much dust out of your house as possible. People who have cockroaches, the cockroaches, when they have feces all over the house, then people are more apt to have asthma attacks. Pollens, more asthma attacks in the spring are likely because pollens and the flowers are growing. Pets, dander. Dander from your pets cause a lot of asthma attacks and people come to the hospital because of their pets. As long as you wash them frequently and keep them more outdoors and keep the dander vacuumed up, it would lessen the attacks. Cigarette smoke. Fires, chemicals, strong fumes, even perfumes can cause an asthma attack. Emotions like anger, laughing, yelling, anything that vibrates the trachea could cause an asthma attack. Colds, flu, sore throats, sinus infections. Some asthma attacks are caused from exercise, weather, the weather being cold, even medications. NSAIDs, aspirins, beta blockers tend to increase asthma attacks. Sulfates in food, and no one really notices when they're eating sulfates in food, but if someone's having an asthma attack, they need to monitor what they're eating. Hormonal changes. A lot of females have hormonal changes, and that's why the incidence of females than males have increased asthma attacks. Treatment for asthma includes medications. You have quick relief medications and long-term medications. Most of these are inhaled corticosteroids, and these reduce mucus in the lungs. Theophylline is a tablet, and it's long-term and opens airways. Quick relief medications are short-term beta agonists inhaled. It relaxes smooth muscles around the airway, preventing them from tightening up. Side effects of some of the medications for asthma are corticosteroids have a wide range of possible side effects. Sore mouth or sore throat, minor nosebleeds, hoarse or croaky voice, cough, or oral thrush. It's best that you rinse your mouth and gargle after using these medications to prevent fungus growing in the back of your throat. A spacer could prevent these problems also. Some side effects from the tablets would be prednisone or something steroidal like that would be increase in appetite, increase in acne, mood swings, and changes in behavior is common. Depression, anxiety, long-term use would be cataracts and glaucoma. The injection side effects would be pain and swelling at the site, muscle or tendon weakness, increased risk of infections, blushing, your skin may be turning red, thinning and lightening of the skin in area of injection. The next few slides will demonstrate how to use inhalers.
Using a metered dose inhaler. Take off the inhaler cap and make sure the mouthpiece and spray hole are clean. Shake the inhaler 10 to 15 times. Without the inhaler, take a breath and breathe out all the way. Hold the inhaler upright. Put the inhaler in your mouth, above your tongue, and between your teeth. Seal your lips around the inhaler. Begin to breathe in slowly. Press down on the inhaler one time and keep breathing in. Hold your breath for 5 to 10 seconds. Open your mouth and breathe out slowly. Using a metered dose inhaler with a spacer. Take off the inhaler cap and make sure the mouthpiece and spray hole are clean. Shake the inhaler 10 to 15 times. Put the inhaler mouthpiece into the end of the spacer. Inhale a deep breath and breathe out all the way. Hold the inhaler and spacer between your pointer finger and thumb. Put the mouthpiece of the spacer in your mouth and above your tongue. Close your lips around the spacer. Tilt your head back a little bit. Press down on the inhaler one time and breathe in slowly and deeply. Breathe in all of the air you can and hold for 5 to 10 seconds. Open your mouth and breathe out slowly. using a metered dose inhaler about 1 to 2 inches from mouth. Take off the inhaler cap and make sure the mouthpiece and spray hole are clean. Shake the inhaler 10 to 15 times. Without the inhaler, take a deep breath and breathe out all the way. Hold the inhaler upright with the spray hole about 1 to 2 inches away from your mouth. Begin to breathe in slowly. Press down on the inhaler 1 time and keep breathing in. Hold your breath for 5 to 10 seconds. Open your mouth and breathe out slowly.
Take your medication as prescribed and pay attention to increasing quick relief inhaler use. If you find yourself relying on the quick relief inhaler such as albuterol, your asthma isn't under control. See your doctor for adjusting your treatment or changing your medications. What is peak flow? Peak flow is the amount of air blown out quickly from your lungs. It demonstrates how quickly you can blow air out. The peak flow meter is marked so you can determine how much air you can blow out. The better your asthma is controlled, the more air you'll be able to blow out. When is it used? While not a good tool for diagnosing asthma, peak flow and peak flow meters are good to monitor asthma over time. You may see declines in your peak flow prior to developing significant symptoms. This will allow you to alter your treatment regimen based on your asthma care plan. What do I need to do? It is important to find your personal best peak flow using your peak flow meter. In order to accomplish this, record your scores from your peak flow meter every day for 2 weeks while you are well. This peak flow can then be used to guide your asthma treatment. How is it performed? It is important you learn how to use your peak flow meter appropriately. There are YouTube videos available. Your doctor will also demonstrate for you and have you return demonstration. Lifestyles need to be changed for asthmatics. First and foremost is avoiding triggers. You want to take steps to reduce your exposure. Use an air conditioner. Air conditioning reduces the amount of airborne pollen from trees, grasses, and weeds that finds its way indoors. Air conditioning also lowers indoor humidity and can reduce your exposure to dust mites. Decontaminate your decor. Minimize dust that may worsen nighttime symptoms by replacing certain items in your bedroom. For example, encased pillowcases, mattresses, and box springs in dustproof covers. Use washable curtains and blinds. Maintain optimal humidity. If you live in a damp climate, talk to your doctor about using a dehumidifier. Prevent mold spores. Clean damp areas in the bath, kitchen, and around the house to keep mold spores from developing. Get rid of moldy leaves or damp firewood in the yard. Reduce pet dander. If you're allergic to dander, avoid pets with fur or feathers. Having pets regularly bathed or groomed also may reduce the amount of dander in your surroundings. Clean regularly. Clean your home at least once a week. If you're likely to stir up dust, wear a mask or have someone else do the cleaning for you. Cover your nose and mouth when it's cold outside. If your asthma is worsened by cold or dry air, wearing a face mask can help. Stay healthy. Get regular exercise. Having asthma doesn't mean you have to be less active. Treatment can prevent asthma attacks and control symptoms during activity. Maintain a healthy weight. Being overweight can worsen asthma symptoms and it puts you at a higher risk for other health problems. Control heartburn and gastroesophageal reflux disease, which is GERD. It's possible that the acid reflux that causes heartburn may damage lung airways and worsen asthma symptoms. If you have frequent or constant heartburn, talk to your doctor about treatment options. You may need treatment for GERD before your asthma symptoms improve.